Good morning, ma'am. My name is Ufoma. I'm a final year medical student currently doing my pediatric neurosurgery rotation. Could I please confirm your name?
Good morning, doctor. Yes, I'm Mrs. Ogenikeve, and this is my baby, Ogenioma.
Thank you, Mrs. Ogenikeve. Ogenioma is such a lovely name. Before we begin, is it all right if I ask you a few questions about your baby to understand what's going on?
Yes, please go ahead.
Thank you. I understand you're worried about Ogenioma's head growth and development. Is that correct?
Yes, his head seems bigger than normal, and he's not doing some of the things other babies his age are doing.
I see. When did you first notice that his head seemed larger than usual?
Around when he was 4 months old, I just felt like it was growing too fast.
And what specifically made you think the head size had changed?
It started looking more rounded and prominent. Even family members noticed. His forehead also looks larger.
Has the head grown suddenly, or has it been increasing gradually over time?
Gradually, I would say, but definitely more than before.
Do you have any pictures from before or growth charts from the clinic?
Yes, I have a few pictures on my phone.
Thanks for that. Have you noticed any delays in what he's able to do, like controlling his head, reaching for toys, rolling, or babbling?
Yes, he still struggles with head control, and he doesn't try to grab toys. He mostly just stares.
I see. Did you notice these delays before or after you started noticing the head enlargement?
Maybe a few weeks after I noticed his head getting bigger.
Has he lost any abilities he had before, like smiling, cooing, or lifting his head?
He used to coo more, but now not so much.
Thank you. Have you noticed anything like vomiting, poor feeding, or excessive sleepiness?
Yes, sometimes he vomits after feeding and sleeps a lot.
Any abnormal eye movements, like the eyes looking downward all the time?
Yes, I've noticed that. Like he's always looking down.
Has he had any jerky movements or seizures?
No seizures, but sometimes he startles a lot.
Any issues with vision? Does he follow objects or people with his eyes?
He doesn't follow things very well anymore.
Has he had any back swelling or abnormalities around his spine?
No.
Any trouble passing stool or concerns with his anus at birth?
No, he passes stool okay.
Did anyone mention a heart condition like fast breathing or blue lips?
No, he breathes fine.
Any choking, difficulty swallowing, or coughing while feeding?
Yes, sometimes he coughs when feeding.
Have you noticed any swelling near his flank or any concerns with his urine?
No.
Any extra fingers, abnormal limbs or toes?
No, he looks normal in that aspect.
Has he had any recent fever, neck stiffness, or trauma to the head?
No trauma, but he had a fever about 2 months ago.
Let me ask more about Ogenyama's milestones. Can he lift his head or sit with support?
No, he struggles to lift his head.
How about grasping toys or putting his hand in his mouth?
He sometimes puts his hand in his mouth but doesn't grab things.
Does he smile or show interest in people?
He smiles sometimes.
Does he coo or respond to your voice?
He used to coo more, not as much now.
During pregnancy, did you have any infections or take medications regularly?
I had malaria in the first trimester. I was treated.
Did you take folic acid?
Yes, but I stopped after the first 3 months.
Were there any abnormalities seen on antenatal scans?
They said everything looked fine.
Was Odianayoma born at full term?
Yes, he was born at 39 weeks.
How was the delivery?
It was a vaginal birth, but labor was long, over 12 hours.
Did he cry immediately after birth?
Yes, but the doctor said his cry was weak.
Any NICU admission?
Yes, for 2 days, but they said it was just to monitor him.
Has he had jaundice, infection, or seizures since birth?
He had jaundice for a few days.
Is he breastfed or formula fed?
He's mainly breastfed with some formula.
Any difficulty feeding or choking?
Yes, especially with the formula. Has he been gaining weight steadily? Not really. He seems smaller than other babies.
Is he up to date with immunizations?
Yes.
Any family history of large heads or developmental delay?
My husband had a big head as a baby, but he grew up fine. How old are you and your husband? I'm 29. He's 33.
Do you have other children?
Yes, a 4-year-old girl. She's doing well.
Thank you. Who looks after Ogenayoma at home?
Mostly me. Sometimes my mother helps.
Thank you so much for answering all these questions. You've done a great job noticing these changes and seeking help early. Is there anything else you were hoping to talk about or ask today?
No, I just want to know what's wrong and what we can do.
Absolutely. I'll summarize what we've discussed and speak with the doctor. We'll likely do a head scan and check his development more closely. You're doing the right thing bringing him in. We'll support you through the next steps.